Now we're going to hear from Dr. Neki Soriano. It's actually the Reverend Doctor. He's a United Methodist pastor as well as a medical doctor. He serves in the Southern General Hospital and program coordinator for the United Methodist Episcopal Area Health Board. I know Dr. Neki, he wanted to join us, but as things happen, he's both on the forefront of providing medical care for persons living with HIV as well as COVID-19. And it turns out he is hospitalized right at this very moment because he has COVID-19. But despite being infected, he made a video because he wanted to get his message from the Philippines to us. And so at this point, we're going to see a video of Dr. Neki.
Hello, good day. This is Dr. Neki Soriano from the Philippines. I am the Health Board Coordinator for the Davao Episcopal Area Health Ministries. And what I would like to share very briefly is the HIV ministry, awareness ministry of the entire Episcopal area with focuses in the grassroots level, the local church. Since we started several months back, our focus has been on making local churches as health outpost. What we want to do is for the local church to be actively involved in the community, raising awareness about HIV and its stigma and discrimination. For the last several months, we have participated with local government celebrations and activities to establish our relationship with the different stakeholders in the community and to be able to show the community that the church is actively involved in raising HIV awareness. We also work with other local non-government organizations and other advocates that has similar activities and advocacies with what we are doing. And so after establishing those relationships, we have reached out to the communities, especially the youth, the high schools in the different key areas in the Episcopal area. So we went in communities, we went to schools, inside their stadiums, their gyms, where we conduct HIV awareness. But to be able to sustain this kind of program, we must be able to have a group of dedicated advocates who will be the prime movers at the grassroots level. And so we started raising awareness among the church youth so that they will take ownership in this kind of ministry. What we want to happen is that they will find a venue for the Christian faith to grow and express their faith by raising HIV awareness, decreasing stigma and discrimination, even within the church and in the community. Of course, we also raised the same campaign with the elderly adults and with other church leaders to get their full support if we wanted to be successful in making the local church a venue for our health ministries. So we talked with different conference leaders, district leaders, especially with the support of our bishop and the office of the bishop staff. We have dedicated advocates and coordinators led by the wife of Bishop Juan, Dr. Lay, and the other staff of the Episcopal area. And for this to materialize, we organize the group of young adults, including church leaders and even church workers, to be part of our core group of health advocates. We call them Tigbansay. So Tigbansay is a lay health ministers program designed to train the youth and the church leaders on raising HIV awareness and how to conduct screening program. So they underwent several days of training so that they themselves will be the resource persons and the focal persons in the different localities and communities that they are able to work around with. And so in the last several months of November, we drumbeat this program with awareness and screening activities in different high schools, different communities, even churches in different areas until the celebration of the World AIDS Day in December. We also piggyback in the many Christmas activities of the youth and the church to increase our presence and to increase the screening of and the participants of the awareness activities as well. In January and February this year, we were able to graduate and organize properly already this Tigbanasay. And they were recognized and consecrated by their conferences as lay health ministers. And they continued their work as resource persons, as the one conducting the screening in the different areas leading to February, which was mostly the Love Month celebration among the youth. So we went again to communities, senior high school students, churches, and other areas as well. But when March came, the COVID-19 global pandemic hit the Philippines also. On March 15, 2020, after several months of increasing cases of COVID, the Philippine government declared a national public health emergency, putting the different islands of Luzon and some areas in Visayas and Mindanao into extreme community quarantine, which means there is no restriction of people movement. And so this took a toll in the activities of the HIV program. We are no longer able to conduct community activities, which is the main activity of our HIV awareness. And we are also no longer able to gather people, gather the youth, and conduct screening tests. However, this also gave us an opportunity to expand the role of the Tigbansay, not only as HIV advocates, but also expanding the role in raising COVID-19 awareness as part of the program of the Davao Episcopal area. And we also made some alternative modes of increasing awareness through social media campaign, because most of our participants are youth. They are tech savvy and they are very well versed in using social media. But one of the things that we were not able to sustain is the conduct of screening tests, because it is only possible when we are able to gather different people uh, in a community setting. But even with the COVID-19 effect on the activities of our HIV awareness, we were able to find other partners as well to address also new concerns that comes up with this new um, COVID-19 pandemic. We were able to work with the Sailor Society Philippines to focus on the mental health awareness, especially of those youth who are isolated or quarantined within the area because they cannot go out, and they have no other means of communication or activities with their fellow youth. And so it's taking a toll on them. And we have included mental health awareness as part of their skills in helping address the not only um, depression, anxiety at this time of pandemic, but also to continue to reduce the discrimination and stigma of people having such mental health disorders, even people with having COVID-19, and even people having living with HIV. And so the mental health awareness program has become an encompassing program to address different concerns of people towards reduction of stigma and discrimination and loving more our neighbors and seeing them as the image of Christ. And as we continue to implement and train new Tigbansay workers this September, we hope that by October, we're able to roll out more awareness activities through the use of social media, through Zoom and Google meetings, and produce social media content also that will still continue to advocate for raising awareness among the church and the community. I hope I was able to share some of the work that we have been doing in the last several months, and I pray that God will continue to keep us safe at this time of global pandemic and continue to give us strength to continue the work that He has called us to do. Thank you and God bless.
Dr. Soriano, we're disappointed you could not join us live today, but our prayers are with you as you are hopefully recovering from COVID-19. We're grateful for your medical ministry and educational outreach to people in the Philippines, as the Philippines is one of the countries of the world that still has a rather drastic rising percentage of persons infected by HIV. So the combination of COVID-19 and HIV in the Philippines is truly a fearful circumstance. And you, as a leader in that fight, are now incapacitated for a while, but we hope that you will recover quickly, and we're grateful for your service.